Let's talk about Section 23 of the Act, which is a very unique section. This is different than in the Food and Drug Act. This section deals with, are the government employees liable? And it basically says they are liable, except in the narrow circumstance of where they're removing a product where they have evidence that the product will, poses a significant risk, and the risk of removing the product is less than leaving it on the market. This is really important because under the Food and Drug Act that we're currently regulated under, there have been instances of state employees causing significant harm and death, and they were warned in advance. There's one case that I'm aware of where, because I was involved in a court case, I speak about it publicly quite frequently, where doctors and psychiatrists and people were writing and phoning Health Canada and saying, we need access to this product or there will be harm or there will be death. I'm aware of a senior public figure who was holding press conferences warning of deaths and then blaming Health Canada for deaths, and yet these employees continued taking the product away, and the court found that what Health Canada was doing was dangerous and actually acquitted, saying it was necessary, it was legally necessary for people to have access to this product. So what we're saying is it's not okay for government employees to think that they can harm us by taking products we rely on away, especially when they're being told. You or I would be criminally liable, we would be civilly liable, but they're not. This section says they are. In the area of health, anyone who is going to harm you and put your life at risk needs to know that they don't get a free pass just because they're a government employee.